Hi, I'm Alison and I'm going to be talking to you about thyroid disorders, in particular Graves' disease. So what is a thyroid disorder? It's any dysfunction of the thyroid gland. This could be through cancerous tissue, over and underproduction of hormones from the thyroid, and other gland dysfunctions. There are 15 main types of thyroid disorders. I'm focusing on Graves' disease, which is the #1 cause of hyperthyroidism in America. So what is Graves' disease? Graves' disease is an autoimmune disease where your immune system attacks your thyroid. The disorder causes the gland to become overactive and produce excessive amounts of thyroid hormone. Thyroid hormone increases basal metabolic rate in most tissues and organ systems in the body. When the thyroid produces more thyroid hormone than the body needs, this is called hyperthyroidism. Thyroid hormones circulate in the blood and affect the metabolism of every cell in the body. Specifically, hyperthyroidism speeds up the body's metabolism and accelerates its functions. Therefore, people with this disorder burn calories and expend more energy than they would with a normally functioning thyroid gland. Some signs and symptoms of Graves' hyperthyroidism include anxiety and irritability, fine tremor of hands or fingers, heat sensitivity, increase in perspiration or warm moist skin, weight loss despite normal eating habits, enlargement of the thyroid gland, which is a goiter, change in menstrual cycles, frequent bowel movements, rapid or irregular heartbeat, which is important, bulging eyes, which is Graves' ophthalmopathy, which that's the bulging eyes that you see in the left in the picture, and this can compromise vision and lead to blindness. That's in extreme cases. Mostly it just makes your eyes dry and is a little uncomfortable. The other uncommon sign and symptom is thick red skin, usually on the shins or top of your feet. This is Graves' dermopathy, which again is a very uncommon symptom among the symptoms. Right. So pathophysiology. Right. So normally the pituitary gland releases thyroid stimulating hormone when the thyroid hormone blood levels are low. This is normal function. Once thyroid hormone levels are high enough, the pituitary gland stops sending thyroid stimulating hormone to the thyroid gland, and the thyroid stops producing more thyroid hormone. So it's inhibited. Now, for individuals with Graves' hyperthyroidism, their immune system makes an antibody called thyroid stimulating immunoglobulin, or TSI. This attaches to the thyroid cells, and it occupies the receptor site where TSH usually is accepted by the thyroid gland, and it doesn't move, and it continuously makes thyroid hormone. TSI mimics TSH and stimulates the thyroid to make too much thyroid hormone. Thyroid hormones influence growth and development, body temperature, heart rate, menstrual cycles, weight, and many other body processes. If all of these processes are using energy to continuously work all the time, it takes a toll on the body and can cause damage to certain tissues that become vulnerable from being overworked. Okay, so epidemiology. Most likely women actually get this between, they develop this between the ages of 30 and 60. Overall, in general for people, men and women, you don't usually see it that much over 40. Women are 7 to 8 times more likely than men to develop Graves' disease and Graves' hyperthyroidism. The chance of developing Graves' hyperthyroidism increases if you have a family member who has it, or if you already have another autoimmune disorder like type 1 diabetes, rheumatoid arthritis, and vitiligo, and which is a disorder in which some parts of the skin are not pigmented. So treatment, there are 3 types of treatments you could get. You could take medication, like antithyroid medications and beta blockers, or you could have surgery to remove your thyroid, or you could take radioactive iodine, which is radioactive iodine therapy, which is also taken orally, just like medications. So all antithyroid medications inhibit the synthesis of thyroid hormone. 3 common medications are carbimazole, methimazole, and propylithrosol. Methimazole is the most commonly used, and propylithrosol is also common. Now, beta blockers may be used at the beginning of somebody's treatment for Graves' disease, because beta blockers will lower your heart rate. They will thus make you more calm. It makes all the nervousness and high blood pressure that is associated with Graves' hyperthyroidism can be addressed. However, it does not fix. It's not really a long-term treatment. It's more at the beginning. All right. So surgery, you could have complete or partial. Once you have surgery to remove your thyroid gland, you have to take hormone medications for the rest of your life. So radioactive iodine therapy. Radioiodine is taken orally, causing gradual destruction of the thyroid gland cell. It can eventually stop all thyroid function, which requires the patient to then take supplemental thyroid hormone medications for hypothyroidism. According to Anthony P. Wheatman of the New England Journal of Medicine, about 30 to 40% of patients who are treated with an antithyroid drug remain euthyroid 10 years after they stop using the medication, which means that they obtain remission and that they remain in remission, which is great. All right, so exercise response and exercise testing. According to a journal article from the American Heart Association, unmedicated or uncontrolled hyperthyroidism patients have symptoms that are associated with palpitations, tachycardia, exercise intolerance, dyspnea on exertion, widened pulse pressure, and sometimes atrial fibrillation. Having this disorder can cause you to have high blood pressure, decreased SVR, increased cardiac output, heat intolerance, rapid or irregular heartbeat, palpitations, or arrhythmia, muscle weakness of hips or shoulders, and increased sweating. That's a lot. The basic exercise response of uncontrolled Graves' hyperthyroidism could lead to myocardial infarction, especially if a graded exercise test was being done. The initial data collected from the patient would contraindicate exercise. Patients who have Graves' hyperthyroidism must be cleared by a doctor for physical activity, because if they have the disorder and it's uncontrolled by medication, they may have elevated blood pressure and heart rate that could contraindicate exercise for them. Having elevated heart rate and blood pressure and high levels of anxiety and nervousness are also indicative of this disorder. People with uncontrolled Graves' hyperthyroidism have an abnormally high metabolic rate. Their metabolism functions as if they were always running on a treadmill, even at rest. So they exercise. So when they exercise, it puts an extreme amount of stress on their body, and they can fatigue very quickly. My case study. My case study is a female. She's 31 years old. She's non-smoker, sedentary, besides walking for 30 minutes a day. She was diagnosed with Graves' disease and subsequent hyperthyroidism without severe Graves' ophthalmopathy or dermopathy. She has no other comorbidities. Her current treatment is taking methimazole 3 times a day for the past 10 months. Methimazole has brought her condition under enough control for her to exercise. It's great. She has a clearance from her doctor to begin an exercise program. Exercise goals include bone strength, increasing muscular strength and endurance. She's also looking to have more energy during the day and sleep better at night. For her risk stratification, her BMI is normal range. Her cholesterol is actually better than normal, which is common for hyperthyroidism, even though she's pretty sedentary. Her blood pressure is a little bit high, but overall she has a low risk level. It's important to remember that although her hyperthyroidism is controlled, it's best to avoid activities and exercises that could be dangerous for her, such as high-intensity aerobic or anaerobic exercise. Also be aware of her heat intolerance. That's important to remember, especially for environmental settings. So resistance exercise is the point I want to stress with this disorder, because it's not per se the exact exercises that you do with this disorder, it's the type of exercise. So resistance training is most important for these kinds of disorders, for Graves' hyperthyroidism in particular. So resistance exercise is the most important part of my exercise prescription because it's not only caters to the client's goals, but resistance training is considered the most beneficial for individuals with Graves' hyperthyroidism. The emphasis on exercise for Graves' patients needs to be on weight-bearing exercises. This type of exercise has the most benefit in maintaining bone density. Studies show that exercise reduces appetite and increases your energy level. There you go. Walking continues to be the most overall beneficial physical activity, and it's available to everyone. For someone who has significant clinical hyperthyroidism, remember, it's as if they are already running on a treadmill every day, even in their sleep. Excessive exercise can cause a patient to go into heart failure if their thyroid hormones are not under control. So make sure she's taking her medication. So I have aerobic exercise, frequency 5 times a week, intensity low to moderate, time duration 30 minutes. Here's a resistance exercise, 3 times a week, low to moderate, 90 minutes each session. I still want her to do flexibility, obviously, and walking and cycling, other aerobic exercises of choice. She can split her time up, her 30 minutes a day, into 3 sections if she wants. So like I said before, the type of exercise is more important. So I gave her a pretty general exercise regimen. So dumbbell press and Arnold press. I didn't give her too much or too many of each. She just wants to improve. She doesn't have really high reaching goals or anything. So this should be more relaxed. Lateral and frontal weighted arm raises on physio ball, that can be fun. Lat pull downs, wall push-ups. Weighted squats, leg press. Weighted calf raises, leg curls, glute machine. Walking lunges. Walking lunges are going to be great. And as far as abdominals go, I just want her to make sure she's balanced and that she's working her abs too. So I gave her physio ball sit-up variations. So I want her to have fun with that, and she can do with it whatever she wants as long as she's not doing the Valsalva maneuver. To conclude, the #1 cause of hyperthyroidism is Graves' disease. So when you have Graves' disease, you usually have subsequent hyperthyroidism. Uncontrolled Graves' hyperthyroidism can be very dangerous when combined with exercise, so watch out and look out for signs and symptoms of Graves' hyperthyroidism. These are my references, and I hope you had a nice time. Bye.